Alan, thanks for joining me.
You bet. Thanks for having me today.
Let's speak directly to the doctor, the provider that is interested in bringing in chronic care management into his practice. Could you educate us as to the undertaking and what it takes in order to set it up correctly, properly, et cetera, and actually get it off the ground running?
You bet. I think when addressing that, a physician needs to examine both a non-hosted or internally operated plan from within the practice, as well as what's offered through a company like WCARE to manage the program for the doctor. So taking a hard look at that, because either one can make sense depending upon how the practice is set up and what the intentions are of the doctor and what they want to accomplish. And when I say that, I mean how comprehensive a program does the practice want to create? What kind of service does the practice want to give to the patient? For example, CMS requires the office to set up a comprehensive care plan for the patient to deal with their chronic conditions. And there's many aspects to that plan and that process. So being properly trained to know what to include in that care plan, and then going through the process of gathering the information, creating a care plan, communicating the care plan to the patient in writing, gathering the proper consent for the program, which is another compliance requirement by CMS, are all front-end pieces to this puzzle. Once that's established, which takes time, then care through the month with that patient and with their care plan and the administrative responsibilities can be very time-consuming. In fact, we spend on average about 60 minutes of time with every patient, with the patient through direct one-on-one communication, as well as the work that we do to support their program. We send them information to deal with their chronic conditions, to educate them. We email that information to them. We send it through U.S. mail. Whatever the best way for that patient to receive information, our responsibility is to communicate that information. So there's many things we do in the background to be able to support that program. So the practice needs to really focus and determine number one, whether they have the manpower to deal with it, right?
Or they're willing to hire the manpower in order to deal with it.
Or hire and house the manpower if they have the fit space.
Where's the actual person going to sit in the office?
Exactly, which is a big challenge for many practices, many of our clients, because they don't have the space.
They have limited space, period. Yeah.
So very difficult. WCARE spends, again, approximately 60 minutes with each patient each month, right? That's a tremendous amount of time for a practice with, on average, 300 to 500 Medicare patients.
Is that many? Wow.
Yeah, our average client is about 350 enrolled patients on the program.
So there's 350 hours of that individual or several individuals' time required in order to service that amount of people.
Yeah, and to bring that down, for every 1,000 patients we have on the program, we have 13 full-time support staff through our health coaches and our administrative staff to be able to support that 1,000 patients. 13 full-time people. So most clinics don't have the capacity or the ability to be able to do that.
Let's assume for a moment that there was space available in the doctor's office. Let's assume. My gut tells me that you're not going to go and find someone to professionally manage this whole system that has all of this knowledge, all of this experience. This isn't one person. This is a team of people. Someone must, as you said, there must be a creation of the comprehensive care plan. It must be done correctly according to standards, rules, regulations, et cetera.
Yes.
This isn't even if let's just say there was 100 patients and it was one person that was going to spend full time on this. My gut feeling is it's not one person, it's several people right out of the gate. And one negative also is, there's that saying, you don't know what you don't know. WCARE, your entire professional responsibility is to take care of this and continue to improve and provide the best service to the patient. you can't replicate that so easily internally, is my guess. Is that a fair comment?
Difficult to do.
Difficult to do.
It can be done, but the question comes down to how much time and investment do I want to make in bringing that off?
I see.
So the alternative, again, is a managed relationship with a company like ours, like WCARE, where we have all the tools in place. We have the trained health coaches, the trained staff to be able to not only meet the compliancies that are required by Medicare, but to effectively help the patient.
You made a comment earlier. You say, it depends on the degree in which the physician wants to create the program. And look, I'm just coming from my own perspective. I think the answer should be, I want the best for my patients. I want to do it correctly. I don't want to do it in a half manner. And just to confirm here, am I correct to say that even if it's a practice of approximately 350, and which seems to be the ones that the type of client you have, you can onboard them in a matter of a couple of weeks? Is that right?
Yeah, onboarding is a fairly quick process.
Yeah.
Depending upon how we communicate with the patient. The effectiveness of the enrollees, of the enrollment process. The effectiveness of the enrollment process is dependent on a number of factors, especially the relationship that the physician has with his patient to begin with.
Sure.
The tighter that relationship, the more that patient leans on that primary care physician to be his go-to person for his medical world, the better the program implementation goes.
Understood.
Yeah.
It seems that it's a few things. It's one is the establishing the connection with the physician's office and all that is required there. And there's also the outreach to all of the patients and beginning that process, right? It seems like it's two different things, correct?
Yeah.
I see. So from my view, what I understand is that, as you said, there's benefits to having an internal, there's benefits to let's say, outsourcing that relationship. One must just fully understand, what are we getting into? Do we have the desire to do this internally? Do we have the space? Do we have the right individuals in order to create the plan? Who's to say that the plan that's created is actually correct, right? I'm assuming professional consultation should be taken if undertaking this particular route.
Absolutely. When we consult with a prospective client, we go through that process. We want to make sure that utilizing our company makes sense from many aspects to the physician. Most importantly, that the physician's office can pull it off successfully and provide benefit to the patient at the end of the day. If the physician can do that and can do that internally and is inclined to go through that process, we're even more than happy to consult on the front end and help them put the platform in place, which is dedicated to CCM, and give them access to run it on a do-it-yourself as well. And if that makes sense for some practices, as it does, then we're more than happy to help with that process.
Understood. And you're walking them through the process as part of your, let's call it, vetting of the relationship, et cetera, and making recommendations.
Absolutely. It has to be a win-win. We already know it's a win-win for the patient-physician relationship, but we need to make sure that it's a win-win between the physician and us, and WCARE as well, that our service is truly a benefit, because short-term relationships are not what we're after.
Understood fully, because you'll spend a lot of time in the first. The heavy load is usually in the beginning too, to get everything set up, and you don't want that to start and stop by any means. It's no good for anybody.
The process is very important.
Yes,
Absolutely.
yes. So it feels as if the physician watching this, interested in CCM, either bringing it on internally or hiring WCARE, has to take into account all of the points we said about, do you have the desire to do so? Do you have the space? Do you have the manpower, et cetera? But the benefit, of course, is that we're onboarding you in a couple of weeks. This is all we do, right? We have the team, we have the process, we have the systems. And I just can't stress this enough. It's that, I'll take it into my own business. I don't do anything else, right? I specialize in a couple of things, and that allows me to do things well and quickly, and I have the right people wearing the right hats. Right. So irrespective of intention, I've built something over years that would be difficult to replicate so quickly, right? And it's the same thing, right? It's the same thing.
Absolutely. It would take you and I a couple of decades to thoroughly get through medical school, internship,
Sure.
residency,
Yeah. Oh, yes.
before I get into private practice
Yeah.
to become that professional.
Yeah.
As in any profession, we specialize.
Yeah. Sure.
And we like to think of ourselves as a great complementary specialist to the clinic.
And you become essentially a partner, right? The trade-off is they have fantastic world-class support, excellent relationship, patients that are happier, patients that are more educated. They're coming into encounters with the doctor in a better way. And what does that mean? It means essentially, correct me if I'm wrong, but it's a sharing of revenues associated with billing. Is that correct?
That is correct.
I understand.
That is correct. We are an extension to the practice. Hiring WCARE to manage this program is just like hiring a full staffing complement to run this program in-house without cost.
Yeah. Yeah. Excellent. With tremendous benefit.
With tremendous benefits.
Yeah.
Other benefits we can touch on, for example, is through our process, we lighten the load on that clinic. As we spoke about earlier, the patient begins to call through the physician's dedicated line through our office directly to our care team, who can take care of and implement many things that previously was handled directly through the practice.
Certainly.
So that lowers the time the practice has to spend directly with the patient, or can spend with the patient.
Sure.
Thereby freeing up the current staffing to do other more important things, which at the end of the day makes money for the practice.
Yes. And as you mentioned before, it's their core competency. They're doing the things in which they should be doing, and leaning on you for the things that they should not be doing.
Absolutely.
I understand.
It allows them to lower their overhead through introduction of this.
It's fantastic. And can't stress enough, benefit to the patient. Unreal, having somebody to call. Again, I said it before, concierge, VIP, these words all come to my mind.
The patients love it. Our health coaches love it because they're making a difference. They're building relationship and helping people, especially seniors. And our baby boom generation over the next 4 years is growing substantially to the tune of 11,000 new Medicare recipients every single day.
Wow.
Yeah.
Talk to me about your, let's say, philosophy or position on training of your team. Because, I said this before, you can't, a physician's office it's going to be difficult for them to onboard the right individual if they intend to do this internally, right? Talk to me about your view on your attitude of training, what you do with your internal teams, how you keep them fresh, how you keep them continue. I'm assuming that things change and et cetera. Like, how does that work with WCARE?
Yeah. So we bring through our employees, our health coaches, go through a full training curriculum, our CCM school, if you will, to become qualified health coach with WCARE. The industry, we also help teach to be qualified health coaches as well, to enhance their abilities to serve the companies that they work for as well. We hire primarily medical assistants as well as CNAs and those with clinical backgrounds as our health coaches. While they're not qualified healthcare professionals such as nurses and physicians, they're qualified from the standpoint of helping patients with their daily needs in accessing their health care.
Understood. Excellent overview.
Yeah,
I appreciate it greatly.